Hello, my name is Tim Nanoff. I'm AOTA's Director of Federal Affairs, and I'm here joined by Jennifer Hitchen, who's AOTA's Regulatory Counsel, and we're going to have a discussion about healthcare reform today, and in the wake of the Supreme Court decision, what has changed and what it means for occupational therapy. AOT has been doing a lot of work on healthcare reform since 2008, and it all has sort of come to fruition with the Supreme Court decision that largely upheld the law. I do want to turn this over to Jennifer Hitchen, who's AOTA's Regulatory Counsel, give a legal interpretation of what it means, and then a discussion of what occupational therapy can look forward to in the next few years.
Thanks, Tim. The Supreme Court heard oral arguments on the ACA, the Affordable Care Act, back in March, and they finally issued their decision on June 28th. The Supreme Court considered 4 legal issues. The first was whether they could even make a decision. They discussed and heard arguments on the Anti-Injunction Act, which would decide whether or not the law was a tax or a penalty and whether they could issue a decision before any taxes were levied. They also dealt with the issue of the minimum coverage provision, which we all call the individual mandate, and whether or not that was a constitutional exercise of Congress's power. The other issue was the severability of the mandate from the rest of the law, whether or not they had to overturn or uphold the law in full, or if they could dice away and just look at individual pieces of it. And finally, the issue of Medicaid expansion. The court ultimately decided on June 28th that the act was constitutional, that they could make a ruling on it, and upheld it. Then we'll talk about the Medicaid expansion issues later. So we were there for the Supreme Court's decision, and now I would like to ask Tim what the implications of that decision are for the practice of occupational therapy.
Well, I think it's clear to say that politically the Supreme Court decision was a big win for President Obama. This was landmark legislation for his administration. If it had been struck down, it probably would have been a very political damaging blow for him. So in fact that it stays is very important as we look forward to the next election. What it means for occupational therapy means that we can take advantage of many of the things that we've learned about the healthcare reform bill for the past several years. There can be no denials for pre-existing conditions. There cannot be rescission. You can stay on your parents' policy up to the age of 26. There are lots of different provisions that are good for everyone in this piece of legislation. For occupational therapy in particular, there is the inclusion in the essential health benefits, that mandatory floor of coverage of occupational therapy as part of rehabilitation, habilitation, and devices. There's a mandatory category that includes the rehab and habilitation, and that is where the home of occupational therapy will be. It provides a real opportunity for us to advocate in the states as healthcare reform is implemented, so we make sure that we take advantage of that success that we had of being written into the federal law. With that discussion, I think we're going to wrap up and let you know that as AOTA continues to move forward, we're going to keep you informed with more of these videos about healthcare reform implementation across the states, individually and perhaps about your state in particular, so stay tuned.